Welcome everybody to the Community Technical Assistance Center webinar series on family alignment. So as people are kind of logging in, I'll just do a brief overview of the purpose of today's webinar and what we hope to accomplish. So today's webinar is specifically a consultation webinar. It's a little bit different than some of our content or topic-based webinars from the last two in the series, because what we want to do is spend the bulk of the time hearing from you. We want to hear your suggestions, your comments, any implementation challenges from the things you have heard in the first two webinars. My name is Lydia Frankel. I am a social worker and trainer and part of the CTech resource team. With me today, I have our other presenters from the first two webinars, Yvette Kelly, licensed mental health counselor, former clinic director, Geraldine Burton, longtime parent advocate, and Jason Jones, social worker and part of the CTech resource team. So we're all here today to talk to you a little bit about some of the best practices that we covered in the first two webinars around the first 30 days, that critical time when you're first meeting with families where a lot has to get accomplished around assessment, diagnosis, and treatment planning, but what really sets the stage for the collaborative process moving forward. So to orient you to the webinar, in case this is the first time that you're on, there's everyone's currently muted. We currently won't be unmuting folks. However, we may offer the opportunity as we get into the chat Q&A sort of portion of the webinar. You do have a chat box on the right-hand side. Make sure to submit all your questions, comments, challenges through that chat box. And there's a little drop-down that says Send To. Make sure you hit Send To All Panelists. Type in your question or comment underneath it and then hit Send. And that way all the panelists can see your questions and your comments. There's going to be a couple times during the webinar where we may be asking a poll question or a specific targeted question. So we really would like to get some participation from everybody to really make this more of an interactive webinar as much as possible and really help through thinking the application of some of the best practices that were discussed in the first two webinars. So brief overview is I'm just going to do a very quick overview of the first two webinars in case there's anybody who's new who didn't attend those first two. And you can also access the webinar recordings and slides in case you didn't see those webinars on the ctechny.com website. All those materials are posted for you to view. We're also going to talk about any implementation challenges or things issues, questions, concerns that you have in applying some of these best practices in the first 30 days of services with families. And then we're going to have some time for maybe touching on some other kind of common questions that have come through feedback that we've already received. And then we'll do a brief wrap-up. So before we get started on the overview, I wanted to pull up this poll question because I think it's important for us to also know who is on the line with us today. So can you tell us how many years of experience you have working specifically with families? So do you have less than 5 years? Do you have 5 to 10 years or 10 plus years working with families? So if you can click that response and hit the little submit button on the bottom on the right-hand side, that'd be great. We'll just give everybody a couple seconds to reply. We'll close out the poll and then we'll see the results. So if everybody can really participate in this will help us kind of gear the presentation as we move forward to the appropriate experience level as well. Great, so we'll see the results pop up momentarily. And I know there's a number of you that are still logging on, so that's fine. The results will pop up on that right-hand panel. Sometimes there's a slight delay. Great, so it seems like we have a little bit of a mix and there's a number of you that didn't get to reply. So I hope we can kind of gather what that experience level is, at least from your chat questions and responses and feedback through that chat box. So it seems like we have some that are newer, less than 5 years working with families, some sort of middle range, and there's still quite a few of you that have also been kind of working with families for quite some time. So thank you for taking the time to reply to that poll question. That's very helpful. So brief overview. We spent a lot of time on this in our first webinar, and again, I highly recommend viewing the recording. So why do we put so much emphasis on those first 30 days? It's particularly an important period because there's a high dropout rate within those first 30 days. It's when clients determine whether they really are interested in services or not. We know that if they do drop out, they usually tend to drop out in those initial appointments. And we know that when they leave, they don't keep it to themselves. So they're going to share their experiences from their perception of whether it was positive or negative with others. And if we aren't successful in those first 30 days, the underuse and overuse of services is increased. So either there's a delay in receiving services, so then they may come back into the system with more severe issues, or there's poor engagement, and oftentimes then there's a sort of coming and going of the system as well, which means they're not necessarily getting the intensity or the right type of services that they deserve. The goal of the first 30 days is really to align with the practitioner, develop that clinical formulation, and attend to caregivers' felt needs. I will also add to attend to the youth's felt needs, especially as they get older. Now, at the end of those 30 days, what you should see is a shared goals or a focus of treatment that both you and the caregiver, if you're asked what are the goals of treatment, both of you would be saying the same thing. That there's an understanding of what treatment is and the role of each individual in the process. What is the role of the caregiver, the child, and the therapist in that successful treatment? So it should be clear to everybody as to what each individual person's role is, and that there's clear agreement on the treatment plan, that everybody has really participated in a collaborative treatment planning process. And that's quite a bit to ask to do in 30 days when you're first getting to know families. This is a different sort of illustration of what we're also talking about, which is this alignment model. And are we really kind of walking away with a shared goal and understanding as to the focus and purpose of treatment? And are we communicating what is that shared understanding and working towards that? Are we communicating what are the clear roles? Are we really kind of having a discussion about the role that each individual has, and is there agreement in those roles? Are we providing psychoeducation as needed, whether it's about the illness, whether it's about receiving services and what that means, whether it's about sort of treatment options? Are we working collaboratively? Is there agreement with the child, and what is the child's perspective on this? And are we really focusing on strengths throughout that whole process? And what we like to call this is really that alignment model, these core components that need to occur in those first 30 days. We spent quite a bit of time in our first and second webinar talking about the importance of collaboration, which I think is part of the hardest part, especially in collaborating with the caregiver in this process, that oftentimes in kids services, working with a child, solely with the child, oftentimes doesn't evidence significant improvement in outcomes, especially in certain populations like kids with conduct problems. We know that we have to engage the caregiver in this process. So that collaborative process oftentimes is very challenging to do for a number of different reasons. And what we want to highlight is that if we really create a tone of collaboration and work through some of those challenges in the first 30 days, you're going to have a stronger commitment and a clearer process of treatment for both the caregiver, the child, as well as you as the provider. And that what we want to focus on is really this mutual respect, that we're really listening to each other, that we're communicating, that we're sharing resources, that families really do have a choice in this process, that we're empathizing, and that essentially that we really are attending to the shared vision, mission, that there's shared power, shared resources, and shared goals in this process. We highlighted in those first two webinars the importance of initial engagement, and I will say, and I'll talk a little bit more about this at the end of the webinar, the next set of webinars within this family alignment series is going to go a little bit deeper into engagement. So we're going to spend even a little bit more time on that in the next set of webinars. But we did touch on the role of initial engagement and the importance of it in clinical formulation and assessment. We talked a little bit about challenges in implementing them, how to collaborate, what are the messages that we should be providing, and also talked about that collaborative treatment planning and goal setting, and how we can make sure that families have all the information that they need to make informed decisions. For example, when we're talking about psychoeducation those first 30 days, are we instilling hope and reducing blame? Are we orienting families to services and not just assuming that they know what this is, what treatment is, and what the options are, and how do you participate in them, that we're actually orienting them to the services that we provide, that we're providing information on the illness or the different issues that you're attending to in services, that we're providing information on treatment options, and that we're overcoming provider and client barriers to be able to do this consistently. And I think many of you, especially in the poll, there was a number of you who said you've been doing this work for many years now. And so I'm really interested in hearing kind of your perspective on this. What has worked for you? What are some implementation challenges that you've experienced? So please, you can start using that chat box now and start sharing some of those questions, comments, and thoughts. But I think a big part of this is really, are we doing this consistently? I think many of us know that these are things that need to occur. So the question is, how do you overcome the challenges that often arise to be able to do them well? And then how do we make sure that it happens at every single contact with that family and with each family we serve? We talked a little bit about determining a baseline, tracking progress, and focus, especially in the second webinar, around discharge planning. So I highly recommend, again, to check out that webinar if you haven't seen it. Download the slides, download the handouts. We had a couple worksheets that are helpful to share for you or for your staff on the ctechny.com website. But the idea of that the first 30 days is also to establish a baseline, because we know that moving forward, especially in managed care, but many of you are already doing this now, is really identifying ways of tracking progress and how do we make sure that people really are achieving improved outcomes, and how do we align that with the goals of the treatment plan. So it's particularly important to establish a baseline in those first 30 days and to determine how you're going to track progress with the families and make sure that everybody's in agreement and that's clear. So we spent quite a bit of time in that second webinar talking about tracking progress, but we also talked about how tracking progress sometimes gets derailed and what are some ways to overcome some of those challenges. So again, make sure to take a look at that webinar if you don't have those materials already, and we'd be happy to answer any questions that you have around that as well in today's webinar. We spent quite a bit of time talking about joint selection of high priority goals, how we go about having that discussion with families, how do we start talking about what are treatment options and making decisions around which is the best approach in working with that family. And we also spent some time talking about the discharge criteria and discharge planning and how we really need to start thinking about discharge from day one. So that's what we covered in those first two webinars. There's quite a bit of content, but we didn't have as much time to really get into some of the implementation challenges that there may be in doing some of those best practices consistently. So that's what we're hoping to accomplish in today's webinar. And a question that I have for you is, are we consistently incorporating these best practices in our work during the first 30 days of services? So feel free to chat in your responses, but we're also going to pull up a poll. And we're going to ask you, and there's quite a few of you on already on the webinar, and it would be really wonderful to hear from each and every one of you. And if there's multiple people in one room just logged into this one webinar, just kind of through consensus, decide what you think the response would be. But do you think you utilize these best practices in the first 30 days consistently is the key word? Do you feel that at every contact with a certain family and across your caseload, do you feel that you're utilizing these consistently? So, is the answer yes, no, or are you not sure? And that'll also help us kind of gear some of our responses as we move forward. So again, the poll should be on your right-hand side in the panel. You can click the appropriate response and then hit submit. And then we'll probably close out that poll as soon as we have a good amount of responses coming in. Okay, so I think we're closing out that poll, and we're going to pull up the results momentarily. Do you think you utilize these best practices in the first 30 days consistently? Yes, no, not sure. Great, thank you. So we got quite a few of you who actually got to participate. There's still some that didn't get a chance to, so I hope we're going to have another opportunity for another poll down the line. So I'm hoping that we get pretty close to 100% participation. But it seems that it's a little bit split. Many of you are saying that, yes, you do feel that you use this consistently. Some of you are saying no, and some of you are saying you're not sure, and there's a number of you that didn't get to reply. So thank you for definitely for those who said no or they're not sure, so also be honest about utilizing this and also taking that time to be self-reflective. So for those of you who said, yes, you do this consistently, I have an additional question to kind of ask you, and this isn't a poll, but this is something for you to kind of consider. Would the caregiver agree with that understanding? So, and I have Jerry Burton here as one of our parent advocates, and I think a main point that Jerry often kind of makes is really getting caregiver feedback in this process. So for those of you who said, yes, I do this consistently, do you think that the caregiver would agree with that they would see the utilization of each of these best practices? And if that's a yes, then you're doing awesome work and you're definitely on the right track. But oftentimes, I think we all know that things get in the way of us being able to do it consistently. So I think it's also pretty common for us to not be able to do this on a regular basis, and that it may not, you know, we may think it's going well, but the caregiver may have a different perspective. So to attend to that a little bit more, I actually kind of took a look to see what people have studied around caregiver and provider perceptions around services. And there's been a couple studies done on this, but I wanted to highlight two key areas I think may be helpful for people to know. One is, and I think this probably isn't news to all of us because we know the importance of the therapeutic relationship, but specifically in looking at parents of kids receiving services, mental health services, the most common reason for early dropout is that there were therapeutic relationship problems from the caregiver's perspective, right? So, and what that really entails is that the caregiver oftentimes did not feel that the provider was aligned with them in terms of the purpose of treatment, that they thought of treatment one way and the provider thought of treatment in a different way, or that they didn't feel that the appropriate goals were being attended to, or that they weren't getting the right amount of information or the information that they were looking for or needed. And that I actually think this is just one study that I referenced here, and the references are at the end, but I actually think that it's actually quite common to see some challenges around the therapeutic relationship. And there's if you come to our webinar around caregiver engagement, and I have the dates, I believe it's March 4th, but I'll show those dates at the end of the webinar. We also spend quite a bit of time talking a little bit about what some of the literature shows around those differences in perceptions. But what this also highlights is the importance of ensuring that we actually are on the same page with families. I wanted to highlight another area that has also been studied is sort of therapist perceptions of what they are able to accomplish in a session. And so there was this one study where they looked at, they essentially videotaped providers as they were conducting their sessions, and they asked the providers how well or how in-depth did they go into attending to the goals of treatment or a specific strategy or some type of a best practice. And more often than not, what they found is that the providers oftentimes identified that they had actually done quite a bit of work on a specific goal or had done a lot of in-depth work with the family on a specific strategy or best practice or an approach within that session. But then they had independent observers look at those videotape sessions, and what they found is that as the observers were kind of going through and identifying what the best practices were and how well how sort of in-depth they had gone, that there was a bit of a mismatch, that oftentimes the therapists said that they had gotten into much greater intensity than what the independent observers were able to see in the videotapes. So I think this just highlights something that is probably nothing new to us as therapists, because we deal with perceptions all the time, but that we may have different perspectives, and that we may walk away from a conversation, two people can walk away from the same conversation with two completely different perspectives, which really just, I think, highlights the importance of getting continuous feedback from the family, but also incorporating some of the strategies we had talked about in the first and the second webinar around utilizing the supervision process or supervisors or colleagues in really kind of getting an opportunity to talk through some of this. How are we applying them consistently? Do we have independent observers? Can somebody sit in our sessions periodically and observe? Can we use the first 30 days checklist that we had sent out to everybody, and that's also available on ctechny.com website along with the webinars, and we'll show it. Actually, I'll just show it briefly in case you didn't get a chance to see it. I hope many of you did get a chance to look at it. But can we also, even if we don't get an independent observation opportunity, can we also just utilize this ourselves and also ask the caregivers many of these same questions and then determine how aligned we are in this process? Are we just having those conversations? Is really sort of the more simple way. Are we having those conversations with families at the end of every session? So we have one more poll, and then what I'm going to ask is for everyone to kind of submit some of your case challenges, your implementation strategies, things that work or don't work through that chat box. But I first wanted to ask you, would it be helpful to get feedback on using these best practices either through supervision, through use of this self-checklist, through caregiver feedback, or some other way? Do you think continuing to look at these issues, continuing to look at the consistency of utilizing these best practices would be helpful? Yes? No? Not sure. And again, that poll should have popped up on the right-hand side. You can click that response and hit submit. That would be wonderful. So I think we'll be closing out that poll, and then the results will pop up momentarily. Okay, I think it'll, as I said, sometimes there's a little slight delay in getting the results, so it'll pop up. Would it be helpful to get feedback on using these best practices? And so thank you for all of those who replied. It looks like overwhelmingly of those that replied, most everybody said yes, it would be helpful. So I'm hoping that we can now spend the rest of this webinar time really talking through some of these challenges, getting feedback from us as the presenters, and through some of our experiences. We have peer advocate, we have clinical director, we have clinicians here who can really attend to it from a couple different perspectives. But also be able to utilize some of the resources, the worksheets, that handouts that we've also given to you as well. So I'm going to hand it off to Jerry, Yvette, and Jason to kind of manage this chat box and try to get some feedback. And it looks like there's a few of you who've already started writing in some of your comments. So please take the time now to submit any implementation questions or challenges in utilizing these best practices in the first 30 days. And whether you're new to the field or you're an experienced person, whether you're frontline or supervisor or director, please submit some of those questions, comments, and feedback so we can have an important and lively discussion.
Hi, everyone. Thank you for submitting your questions thus far. It looks like we're getting a few that are coming in right now. So I wanted to give the opportunity to Jerry and Yvette to start answering some of these. So one of the questions that came in is talking about family advocates and how they're utilized throughout this process. So Jerry, could you talk a little bit about that?
Oh, sure. As far as the treatment process, it's important to have a family advocate involved, if at all possible. It would be wonderful if all provider agencies had a family advocate. However, I know that's not the case. But if you can utilize one to help with a family, that would be great. For the simple fact, most, if not all, of the family advocates have lived experience, and they have been through some of the things that that parent or caregiver that you are partnering with have experienced. So it helps, it can be very helpful to the treatment process. And it's a win-win situation, not only for the parent, but for the provider agency therapist or social worker as well.
And let me just comment, too, as a provider, you know, I didn't have the opportunity to work with many family advocates because we were not fortunate to have one. But when I did work with an advocate who came with the family, I think it also helps in kind of bridging the gap between communication. I think it, you know, provides kind of a different level of, you know, here's what the family is coming to you with and wants, you know, assistance with. And so I found it very helpful in just being able to talk with a family advocate around their experience with the family, and also to clarify some misunderstandings I may have had related to what the family presented.
Great. Thank you, Yvette and Jerry. So one question that we do have is how to manage situations where the caregiver has one prioritized at the outset of therapy, but then sorry, hold on one second.
So we had a question, a couple questions are coming in, and thank you, everybody. I think we're going to attend to one that's specific to waiver services. These are all, a lot of the things that we covered are really basic expectations of our program. And so I guess it's more of a comment, but I actually want to piggyback that waiver question also to case management, so and care coordination in general. So I think another question that, although I think most would say that these are best practices across the different types of services that we provide, oftentimes you know, should we think about them a little bit differently? And I'll ask Yvette, should we think about them a little differently depending on the types of programs? So, for example, in care coordination or case management programs versus clinic programs versus residential or some other type, should we be thinking about these a little bit differently?
I think there's some foundational skills in working with families in general and individuals in general. And so I find the skills that we talk about in the best practices are really foundational. You could do them in any environment. You know, it really is about getting to understand the family or individual's concerns, working with them and collaborating them on how they want to best address them. I think sometimes we have to be careful because as providers, sometimes we come to the table thinking we know what's best for the family, and well-intentioned, but we have to realize that there's choice for families, and we have to be able to empower families to make that choice. And so sometimes families present concerns or issues to us that we feel are not priority, but the family wants to work on them. And so we really need to start where the family is. And those are just, again, foundational engagement skills.
Right, and I think also the core message is that these are, essentially these best practices should be able to apply no matter what setting we're in, that they aren't specific to a clinical program, they aren't specific to a clinician doing them, there's also family support providers, case managers. I think that these are just core kind of relational concepts that I think are particularly important, core relational and communication concepts and skills that I think can be applied no matter who's delivering it, the service, and no matter what service it's in. Did you want, I think we have another question also on prioritizing.
Right, so the question specifically is, how do you manage situations in which families come to therapy with their own priorities, but as the sessions progress, the therapist noticed that there are other needs that should be prioritized, such as family dynamics, abuse, et cetera?
Yeah, that's a great question, and I think my best answer to that is I collaborate and talk with the family about that. So it's a process not of my, you know, while I'm working with families, I'm constantly assessing what are the needs, but I'm not really holding that to myself. I'm talking to the family about those concerns and needs, and then we're developing a plan collaboratively in terms of how to address it. Have there been situations where I would definitely feel that there's a particular issue or concern that I think the family should work on, and they're not in a place that they want to work on that? Of course. And I think that what you have to do, again, is meet the family where they're at and start where the family is. Again, families have choices. And so if you come from a perspective of trying to force them to buy into your agenda, you may find that your family will not come back.
Yeah, and I find as a family advocate and someone who's worked with families for about 12 and a half years, doing direct service with them, that was a lot of the feedback that I got from families as far as treatment and services that were provided through provider agencies. So again, I have to reiterate again what Yvette said, meet the family where they are. Ask those questions, you know, and do that active listening to be able to get, you know, the partnership and help them along their journey. And it will really play off in the treatment process. It really will.
Right. And also, you know, I think as time progresses, you may find that the family or individual is more willing to, you know, work on things that you have identified because you've established that relationship, you've provided that choice, and you've talked with them about that. And so that, you know, you might find that that becomes easier down the road.
Great, thank you. I also wanted to kind of reply to a comment. So there's another comment that also came in around, you know, that these are also some core components of our program and that we expect that most of our staff are doing this. And I just want to highlight the word expect, because I think the challenge here has been, especially, and, you know, I'm looking at Jerry, who's done a lot of work directly advocating for parents in a lot of our systems, is really that we expect that these things are happening, but are we sure that it's occurring? Okay. And I think that's the key question. I think part of it is making sure that all providers are clear on what the best practices are, and not assuming that, you know, based on our experience and backgrounds, that we're all on the same page. It's possible we have learned different things in different places at different times. You know, do we all have these core components? Do we all understand what these are and how to actually implement them? One thing is knowing that I have to engage. Another thing is actually doing it, especially in as varied circumstances as many of us are working in, with all the different challenges that can pop up. But then, as a supervisor, and I'll look at Yvette in terms of, I know you did quite a bit of work around engagement with your staff, was how do I know that they're actually doing this? Oftentimes things are happening behind closed doors, and if we know from the literature that perceptions are going to vary, should we utilize something like independent observation to help us be clear? And really not so much in a way of and I want to highlight that this is really to continue our learning and professional development. And I think that's the key thing, is that it's about continuing our professional development and ensuring the consistency in our practices, because in the end, we're all going to benefit in this process, not just the families, but ourselves and the services that we provide.
Yeah, Lydia, you bring up a good point. Let me say that misalignment with families can happen at any point in the process. So engaging with families is not a one-time thing. You don't do it in the beginning and then don't do it, you know, throughout the remainder of therapy. It's ongoing. Misalignment can happen at any time, and so you always want to build a mechanism in which you're checking in with families, that you're asking, so that you guys can ensure that you're on the same page. And I found that some of the providers who did that consistently, in terms of just checked in with their families, whether it, informally or formally, but asked for feedback regarding the family's perceptions and experiences, they definitely used that as an opportunity to learn and grow and became really good at engaging with families. But that was because they worked at it. They asked the families, they got feedback from the families, and then they put that feedback into play. And those who were able to do that consistently were light years ahead of others who had very difficult times engaging very difficult clients.
Right. Thank you all for those wonderful answers. I think that one of the most important questions that we usually get during any type of training or webinar is, how do you really utilize these practices within a 45-minute session while trying to complete paperwork and listening to and engaging families? How can you really strike that balance?
Yes, and that is often a question that we get, and I will tell you that it can be challenging, and different things work for different people. I'll use my own experiences when I was doing individual clinical work. You know, I was charged with meeting with families, and through that meeting, doing an assessment and coming up with really like a plan relatively quickly. And when I first started doing that work, I'd go and, you know, I actually did community-based work, but I'd go out in the community and I'd have my little clipboard and I'd have an assessment, I'd be asking those questions, and I'd be ticking them off on the list. And then I'd leave the house, and I really couldn't put the story together for the family because I wasn't asking them in a way that made sense to me or that I understood the family's story. And so at one point, I put the clipboard away and decided that I was going to try to do something different so that I could walk away with a great understanding of what was happening with the family, what were some of their concerns, and how I could best help them. And my strategy in that particular situation was, oftentimes when I went into homes, I saw lots of pictures around, and so I would ask the family about the pictures on the wall. Who is this person? You know, how are they connected? And, you know, the first time I did it, I just saw the family light up, and I really walked away with being able to write the story of what was going on with the family. And so I found that to be much more effective than my sitting there asking questions with the little clipboard. And so my point to that story is that it's going to take, you know, providers to be kind of creative in how they gather that information, how they interact with their families. I can tell you that from experience, when you build good relationships with the families, that information comes out way easier than if you are just kind of doing it in a mechanic type of fashion. So it is possible to get done, but it does take trial and error. It may take you a little while to figure out what works for you, what works for the family in order to kind of meet those, you know, those requirements.
Thank you, Yvette. We're getting tons of questions coming in. Thank you all for your participation. I think a great question that just came in is, how do you utilize these best practices with mandated families? The assumption being that you work with them in different ways.
Yeah, that's a great question. So working with mandated families is the perception that that the family is automatically going to be resistant because they're mandated. And I always come from the perspective of a mandated client, that's an external force that got them there. The true question is, what are you going to do now that they're there? And so, you know, I think trying to understand, again, it's their foundational skills, trying to understand what that individual or that family needs, even if it's, I'm coming here because I'm, you know, I've been told that if I don't come here, you know, CPS or, you know, is going to take my children away. So even if it's that, I start there and work there. You know, okay, so how do we move from that, you know, from the perception that, you know, they're going to take your kids away? What do we need to do? So you really got to kind of assess and start where the family is. And don't make the assumption that because they're mandated, they're not going to be active and participant, you know, individuals in treatment, because that is not an accurate assumption. And sometimes, again, just starting there and hearing their concerns gives you a good gateway to begin the dialogue and begin working with those families.
Thank you, Yvette. So we do have another question that came in just now about cultural differences and really aligning with families. I wanted to toss that to Jerry, if you could talk a little bit about maybe some questions or best practices that clinicians that you've come in contact with have used to best talk about your cultural differences and how you can use that to engage families.
Well, I mean, that is very, very important, and that's a great question. And again, in order to be able to work effectively with the family, you do need to know about their cultural differences, their background, you know, how do they interact with each other, what do they, how do they feel about being in treatment, have they been in treatment before, you know, those type things, because those are the things that are going to help you going through the journey of doing treatment with them, and it's important to know that. Yvette, you want to share something else?
Yeah, and I think it's just important to be an active learner. When when you work with, especially when you work with a diverse group of folks, it's always your job to be out seeking kind of opportunities to learn more about everything. You will never know everything about every different culture, every different religion. And sometimes families are great kind of, you know, families help you understand them if you ask the right questions. So instead of being, you know, nervous that, you know, you're going to offend someone, if you do, you really apologize for that, but you tell them that this is their way of helping you understand. And most families are open to that.
They are, and I think a lot of times, I mean, I know I've worked with some families, they don't want to deal with medication, so they, bring to the table about holistic things. So, I mean, and even if you don't know about those things, I would suggest just say, well, I don't know about these things, but I will get back to you, about it. Don't be afraid to say, I don't know, because as Yvette said, we don't all know everything, but at least be open and honest and forthright about it,
And I'll also just add, if you're really coming from a strength-based perspective, those cultural differences may not necessarily get in the way of this process. If you're really kind of utilizing those best practices and a strength-based perspective and highlighting and communicating and trying to understand each other, then a lot of that gets diffused a little bit. But if you're coming in with assumptions of what they do or what they practice or who they are, that is actually when a lot of those differences kind of get in the way. So if you're really coming from that strength-based perspective, a lot of this doesn't become as big of an issue, and then the active learning process in that will really help you get on the same page with families in terms of the experience that I've had. So we have a couple other comments that have come in. I just want to highlight if there's any specific case examples as well. So if you have a specific case that you'd like to kind of pass by us, any specific challenges, or if you've been doing this work for quite some time and you have some recommendations that you'd like to share for others, please go ahead and use that chat box and submit them, and we'll make sure to share them as well.
I'd also like to highlight a great comment that came in, not so much a question, but thank you, Robert, for saying this. One of the key attributes to achieving consistent engagement is curiosity. Having a list of questions can be part of that, but it is important to hear the story and let your curiosity follow from the information that is shared. And I think that perfectly piggybacks off of what really all of us are saying, is that having that curious nature really helps achieve engagement within the work that you're doing. And Robert's comment was that he worries that the time constraints are really going to impact the quality of engagement. And I think that all of us would agree, but it's not so much something that has to happen within the first session. So it's something that is ongoing, and listening to the story and having that sense of curiosity should continue throughout treatment. So thank you again for that comment. Please, if you have any other stories or comments to share, please let us know, as well as case examples, as Lydia just said. I will ask one question that did come in, and that's, how do you include collaboration with the school in this mix? What should we expect from schools?
I think work with any kind of service providers who are working with individuals and families are important, and actually piece of the puzzle and solution. And I think as providers, we need to do due diligence and make sure that we reach out to schools and teachers and other service providers to really get an accurate, comprehensive picture of the family and some of the needs. And so I understand that sometimes that can be difficult because schools are under stress, and sometimes it's difficult to connect with them. But again, I've been very creative in how I've connected with schools. Email's a good way. Sending notes to the parents, I found, was a great way when I'm trying to interact with a teacher or provider at school, and the parent is either picking the kid up or dropping the kid off. That's helpful. But I think it's important to not neglect that. And again, not just schools. If there's an after-school program the child participates in, if there's a home daycare that the child participates in, so anyone who's touching that child and family's life is important to talk to, because they could be a resource as well.
I wouldn't even go so far as to say even the babysitter, because I remember a time when I was working with a family, and the babysitter spent just as much time with this young man as the mother did. And so, as a matter of fact, the babysitter was the one who came into our office, because we were working within the neighborhood in the Bronx here in the city, and she knew that there was something going on with this child, and she came by and said, okay, I know this mom is having some issues, so I want to know what can I do to help her to get services. So she came in, and as a result of that, the mom came in and we spoke with her, and her dilemma was about medications, and her whole issue was her brother had been on drugs many years ago, and we sat her down and we, gave her information. We explained to her there's a difference in the drugs, the street drugs, and those that are for children who have diagnosis. And we just allowed her to come in anytime she wanted to. She lived in the neighborhood. She worked in the neighborhood. She came in. She cried. We spoke to her. We gave her support. And about 3 months later, she finally decided to try medication for her son. And when that happened, and a month later when she shared with us what had happened, she said, I don't know why I didn't do this much earlier. But we were saying it's okay because, again, we want you to be informed, so you were able to make an informed decision based upon the information that we shared with you. And, just being there for you, meeting you where you are. So that was very successful, very successful.
Thank you, Yvette and Jerry. I think that the main message there is that when you're working with families, you're not only partnering with the family, but you're also partnering with every system that impacts that family. And it's not only good for information gathering, but it's also great to show the family that you are vested in their interests and you do want them to get better in some way. So really engaging with all the systems that impact them will go a long way. I think another question that came in is how can we utilize this information for case management programs?
And I think we covered that a little bit before, so thank you. I think the idea is that these are core best practices, that no matter who's providing the service, no matter what setting we're in, it's basic therapeutic kind of relationship processes, relational processes, communication processes that need to take place that aren't always easy to kind of talk about, but aren't always easy to implement. And I think that's sort of the key message. So I think no matter what setting you're in, these are the same sort of core techniques and messages that should be communicated to the families.
Right. And I think it's important to know that in this type of work, the provider, you are your best asset. If you think about working with families, what's the tool? You're the tool. Yep. And so if you think of that from that perspective in terms of how it is so important to make sure that you are, understanding of best practice, are continually learning, are continually looking for feedback, because you are the tool that's shaping the lives of others. And I just want to say that because I think that's important to know.
Great.
Great. Thank you. So another question that came in is really around this area of feedback and getting feedback from the family. So one clinician noted that they do think it's a best practice to really ask the family how the sessions are going, but does that really impede the progress of the treatment? Should you do it every session, every few sessions? What would you recommend?
Yeah, I think that as a provider you can choose how to do it, but I have told providers that I supervise, I didn't do it every session, but they check in every couple of sessions. They might check in every session and say, was this helpful, but they might deliver the entire kind of survey every few sessions. And again, I think the feedback is so imperative to being able to make sure that the provider and the family are on the same page, because at that time, what you can also do is clear up any misconceptions that have happened during that time so families are not leaving with one thing, or, you want your families to feel comfortable enough, and I always say this really on the onset, I hope you feel comfortable enough to tell me the truth about the service, because I want to be able to, help you, but also help other families. So I put that as kind of an expectation that they give me, that it's honest feedback, and they're just not, circling, yeah, it was good, and they really think I suck. And I always say to them, if you really think I suck, just tell me that. I'm here to learn, and you're here to learn, and so it really creates this kind of collaborative relationship where it's a give and take. Relationships are give and take, and that's what I do with families.
No, I think that's right on, Yvette, and again, it's just so very important to keep those lines of communication open from the onset, as we all said. Again, meeting that family where they are, letting them know that you're there to partner with them, because most families, when they come in for treatment, they've heard from other families and caregivers, they're looking for that provider to tell them what to do. So when they come into a setting where, the provider is being very positive strength-based, wants their input, wants to really partner with them, it's like a culture shock. So it takes them a while to get used to that. So again, just be yourself, be open-minded, you know, active listening, all those basic things, and again, and I promise you, it will work out, definitely, you know, and just you know, be patient, because it doesn't happen overnight, but if you get through those first 30 days and you do the basic things that we're talking about, I'm sure it will be just fine.
Right, thank you so much, Jerry, and Jason, for kind of managing some of the questions that came in and some of the comments. Feel free to keep submitting some feedback, some questions, some cases, some comments. If we have, we're going to move on to a couple other kind of main points that we wanted to share. But if there's a couple minutes at the end, we'd be happy to continue kind of replying to the feedback. So I think sort of the couple key messages here are the importance of this time period, that there's a number of different things that can get in the way of us being able to do this consistently. It sounded like, based on the feedback and the poll questions, that everybody thought being able to get feedback, whether it's from a supervisor, whether it's independent observation, whether it's caregiver feedback, is particularly important, and to really be able to use that as part of our own kind of professional development as we move forward. And on a director level or on a clinic level, it's really just part of continuous quality improvement, that there's always something new that we can shore up, there's always something new that we can learn, and it's really part of a CQI process and trying something out and seeing if it works and continuing to enhance the experience that our families have. And personally and professionally, it also continues to help us make sure that we're on our toes, that we're doing what we can, and that we're being consistent. So I wanted to highlight some of the sort of suggestions that we have around implementing some of this, and whether, again, you're frontline staff or a supervisor or director, these are some tools and resources and some recommendations that we have for you to help you implement these consistently. There's this first 30 days checklist that I hope you utilize, and actually I would like to know if any of you got a chance to utilize the first 30 days checklist. If you can just take a second and send me some feedback. And were you able to kind of look at the checklist? Do you think it's helpful? Have you utilized it yet? Please submit some of that feedback for us, because it's helpful as we continue to develop tools for you, that we get some feedback so we can continue to improve upon them as well. We also will have a feedback survey at the end of the consultation webinar that will pop up, so please submit feedback that way as well. So if you can take a second to reply in the chat, that'd be wonderful. So what we have here is about, 29, 30 questions or statements that help you kind of think through, are you applying these best practices in those first 30 days, and if there's any area of specific improvement. And if there is an area that you'd like to focus on, then there's this action step. Now, if you don't see me scrolling, you have a scroll bar. If you have a scroll bar and sort of in the middle of the panel, you can move it up and down yourself. And there's an option here at the end for action step for improvement. And again, this is about to continue to improve upon the work that we're doing. So if there's an area that we feel we need additional help in, or that we need to kind of shore up or do differently, this is a sort of a little how-to around how to start thinking through, what can I do differently? Do I need help from anybody? When will I do it? How will I do it? Where will I do it? What will get in the way of me completing the action step? So what are some things that I can do to make sure that I'm providing reducing barriers? What are some things that I can do to ensure that I'm validating, empowering, focusing on caregiver strength, for example? If that's an area of improvement, this is a little sort of worksheet to help you think through how to implement that. On a supervisory level, you can also think about applying this across staff, maybe talking about it at a staff meeting, utilizing it in supervision. But how can I help support as a director all the different staff that I supervise in ensuring that this is being done consistently, and how can I help them and support them in continuing this professional development? And so the webinar, the slides, the handouts, the checklists are all on ctechny.com website, and you can access and print all the materials from there. The checklist can help in your own work after each session or before as a reminder. So if you work with a family, you're working in the first 30 days, maybe taking the checklist out and actually doing a little self-assessment for yourself will be helpful. You don't have to share it with anybody, or you can and bring it to supervision or talk through with somebody else, or you can also use it as a guide to get feedback from families. No matter the experience level, we'll all need reminders at different times. The checklist can help in supervision of staff, for example, discussing implementation at a staff meeting, supervision sessions, and observing sessions, and utilizing it as part of caregiver feedback. And again, I'm getting questions around accessing the checklist at the ctacny.com website. I wanted to highlight an important kind of point, and I think this came also kind of reinforced it for me from the first webinar where we got quite a bit of feedback when we started asking folks what got in the way of being able to implement this. And there was a theme of essentially compassion fatigue or being on the path of burnout, and how sometimes being overwhelmed and frustrated can get in the way of actually doing some of these best practices. So I wanted to highlight for you that if you feel that you're on the way, you're on that path to compassion fatigue, burnout, or maybe you're suffering from secondary traumatic stress and working with clients as well, that oftentimes these are those practices that kind of go out the window because it starts impacting. Having those experiences, being unable to kind of manage that work stress does start getting in the way of building positive therapeutic relationships. So I wanted to highlight a resource for you. And I also think if you're a director, supervisor, that it's important to share some of these resources with your staff as well. A few months back, we did a webinar on workforce resilience, helping the helpers and managing work stress. And you can access that webinar on ctacny.com, and there were also some self-assessment tools there as well. So I highly recommend that you feel that this is something that is important to consider for yourself or for your staff to check out that webinar and check out the tools and resources and see if it will be helpful for you in your day-to-day work. So the Family Alignment webinar series really touches on best practices, right, in working and collaborating with families. And I just wanted to highlight that this is, because we also got a few questions around managed care. What is this going to mean for managed care? And I think we can all say that if you focus on shoring up best practices, you will be aligned with managed care regulations. And in fact, you'll probably be better able to comply with them. For example, you're going to be asked to identify family progress and are they achieving outcomes, and you're going to be asked for documentation. And so if you're following a lot of the best practices that we covered, if you have a truly collaborative treatment plan, if you have clear goals, all the things that you're going to need to submit to managed care, to get reimbursement, to get authorization, or to ensure that families are getting the services that they deserve will be met. So I think it's important to really get back to the core competencies and those core best practices in preparation for all the different changes that are coming down the line. To highlight that, our next core set of webinars within the Family Alignment series will focus more deeply on caregiver engagement, March 4th, 12 to 1. And that will be specific strategies on engaging caregivers in mental health services. We also have a wonderful speaker from the Child Welfare Organizing Project that's going to talk about engaging caregivers in child welfare involved families. And then we're also going to do another consultation webinar at the end of that series, the same way that we did today. So we're going to do 2 webinars focusing on engagement, and then another consultation webinar like today where we can help problem solve implementation and address any comments or questions that we have. There will also be another checklist specific to engagement that you'll be able to utilize to guide you in that process. So I think I'm just taking a look and making sure that we don't have any additional questions or comments. I think that's okay. Somebody did mention that a helpful approach is evoke. What does the family want? Provide the information they're requesting, and then evoke again. That way you're getting ongoing feedback that is part of the conversation. So thank you so much for sharing that. I think that's also another way of kind of thinking through and simplifying the feedback process. This is the website, www.ctacny.com. Here are all our emails. Feel free to contact us directly or contact us through CTAC. We'd be happy to answer any comments or questions that you have. There will be a feedback survey that pops up at the end. Please feel free to send us some feedback on recommendations, suggestions, as we do look at those and try to apply them as we move forward in developing our content. Thank you so much for taking the time and participating in today's webinar. Have a great day.